Hello everyone, I'm Limbani Tengo, Medical Informatics and IT Manager for Partners in Health in Malawi. I'm going to give a presentation together with my colleague Anna Rogers from Medic Mobile on our work that we did titled Community and Facility Health Information System Integration in Malawi, a comparison of machine learning and probabilistic record linkage. So overall, in terms of setting, we have several arms in terms of delivery of healthcare here in Neno district in Malawi. We have screening at the community and health facility for different conditions including HIV and non-communicable diseases. So once someone has been screened, they are referred to the health facility where once the condition is confirmed, they are enrolled in care and they come for routine visits over their stay in care. And the other component is the community health part, where we have community health care workers who routinely visit households for different conditions or just overall visits at the household. And they are also a key component for the next component that I'm going to explain, which is the tracking for retention for all the different patients who are already in care for the different conditions like HIV or non-communicable diseases once they miss their appointments. So the whole process starts from the moment that the report is printed from our electronic medical record system called OpenMRS, and once it's printed, we have a team who goes to the health facility to verify whether those patients really missed their appointments or if they were just missed from being captured in the EMR. And once they have verified the names, the final list on day 4 is sent to the community healthcare worker teams in the community who continue from day 4 to day 8 to visit the households to find out whether those patients, maybe they probably transferred out or were lost to follow up. Once that is done, then the final outcomes are shared with the medical informatics team who capture the data in the electronic medical record system. So this was the use case for our work. We wanted to integrate the electronic medical record system OpenMRS with the community healthcare worker application so that all the information for patient tracking can just be shared between the two systems and the outcomes are completed from the community healthcare worker side. So as you can see, the idea was to generate automatically the report from the electronic medical record system, and for the community healthcare team to be able to receive the report where they can complete it, follow up with the patient in the community, and then submit the outcomes. So this work is of the utmost importance, and it's really hard in our context because when you look at the electronic medical record system OpenMRS that we use, we have over 8,500 patients and 5,678 NCD patients who are active in care, over 14 health facilities. So to link it, it's such a tough task, which required us to explore probabilistic methods to link the patients between the two systems.
Thanks, Limbani. I hope this part of the talk will help you to think about how you might apply record linkage to your projects if you find yourself in a similar situation. So I'm going to draw on our use case of matching patients between the CHT and OpenMRS, but you can apply these concepts to a wide variety of applications. we developed a patient matching module using this industry standard architecture. You can think of the high-level function here as comparing one record pair and classifying it as either a match or not a match. Record pair is a term that I'll use quite a bit to mean one record from Yandanafe, the CHW's app, and one record from OpenMRS. One of the two key components that I'll discuss here is the record pair comparison step. So the objective of this step is to produce a quantitative measure of the closeness of the two records. So we're showing an example patient record here, a synthesized example. One collected by the CHW, and the other one is from the EMR at the facility. You can observe that the record pair has several attributes we can choose to compare. So there's first and last name, there's sex, age, health program ID number, village and facility where they go for care. In this step, we use a comparison function to measure closeness for each attribute on a scale from 0 to 1. A score of 0 would be very dissimilar, and a score of 1 would be a perfect match for that attribute. So there are many types of comparison functions available. For example, in this use, we use string edit distances, namely Levenstein, to measure closeness in names. In this example, the last names were spelled slightly differently. One had an extra A on the end. And so the pretty high score of 0.86 reflects that. But while the first names seem similar to us because they are phonetically similar, the spelling differences are reflected in a lower score. The next big component that I'll cover is record match classification. Here, record match classification is just a binary classification that uses those similarity scores that we just calculated from a record pair to model if the record pair was a match or not a match. And I hope that this part of the talk will really bring some clarity around why using probabilistic matching and machine learning are beneficial here. So rules-based matching algorithms might be the most intuitive first step to record classification. The different plots shown here start to give an idea of how you might think about this. These plots show the similarity score for 600 known matching records between the two databases and 600 randomly selected and validated non-matching records. The first plot is last name similarity. So for example, this seems to be a pretty good indicator of matching status. These matching record pairs tended to have a score of 1. We see that nice peak at 1. Where the non-matching record pairs skewed toward 0. And an example of a rules-based approach here might be to say that a record pair is considered a match if the health program ID numbers are an exact match and the record pair had a similarity score and last name of greater than 0.5. And if those conditions were true, we considered it a match. And any other record pairs where those conditions were not true, we would consider not a match. And we indeed first started this whole approach developing a rules-based approach pretty similar to that one. But they really require a lot of hand-tuning to make them work. So the existence of this match data set between our two data sources from the exploration of the rules-based matching motivated us to explore options that could instead use that data to learn the relationships between record pair similarity scores and matching status. Sort of at the core of this work is an experimental study to match patients in our application using data-centered classification models. More specifically, we compare probabilistic record linkage to logistic regression. So for the logistic regression, we trained our model using 1,370 record pairs developed during rules-based algorithm exploration. And our training showed exactly what you would want. A nice converging line indicating it had sufficient data to learn the relationships present, and then a validation curve that performs only marginally worse than the training data curve, indicating there wasn't a gross overfit. Probabilistic record linkage, also referred to as the Flaggy-Santer algorithm, is used pretty widely, including in some of the existing health information exchange client registries. I like to think of this algorithm as pretty similar to a Bayes classifier, but it operates on a strictly Boolean version of those similarity scores. So a common argument for the probabilistic record linkage is that you can use an unsupervised learning technique to define the weights for this type of model. But we ran into some difficulty with the unsupervised weight calculation, and we're not able to get it to converge. So we ultimately used the same training data to calculate those weights, and this would be a really good direction for future work. For the final evaluation, we had to manage the challenge of the overwhelming number of record pairs we would have to label to accurately evaluate the system. So instead, we ran the system on 400 record pairs not previously seen in model training, set a reasonable threshold to investigate those record pairs, and our team members labeled that data set. That resulted in 467 record pairs, 247 were matching pairs, and 200 were non-matching pairs. The precision recall curves here look similar, and both have an average precision of 0.86. For a high precision system targeting 90% precision, logistic regression would perform a bit better with 74% recall and 66% recall for the probabilistic record linkage. But the selection of the optimal operating point would have ultimately defined the best classifier to use here. So in conclusion, we showed that improved community and facility health information integration would promote better care activities and reduce health worker burden in Nano Malawi. Machine learning and probabilistic matching classification models perform similarly when trained on the same training data. Logistic regression was a little better for us. And with respect to future work, there are a couple of areas that would be great to investigate further. So first, we'd like to modify the evaluation of our system. In our final evaluation, by limiting records to label to those above a very reasonable threshold, we could have unknowingly introduced some false negatives. It seems unlikely, but there's a possibility. It would be nice to address this through a better labeled data set, or more simply by evaluating the record linkage system as a ranking system, since that really is how it functions now. And second is the use of an open source client registry tool. So these have the advantage of additional features such as nice UIs and offer the ability to interoperate with even more systems. So these tools, the tools that we examined, used rules-based methods and probabilistic matching algorithms. And so overall, we're hoping that this work would guide the selection and configuration of those available tools. Thank you to this amazing team who put in a lot of hard work, and thank you for listening to this talk.